Pearson Ravitz' story begins with Dr. Stephanie Pearson, a passionate OB-GYN at the height of her career. But when a shoulder injury struck during a precipitous delivery, her dreams were shattered, leaving her unable to practice medicine. Determined to make a difference, Stephanie became an advocate for her peers, guiding them through the complex disability process. Alongside insurance expert Scott Ravitz, Stephanie founded Pearson Ravitz, a company determined to approach insurance differently. Together, they set their mission to educate and empower physicians to protect their most valuable asset, their income, and the most important people in their life, their family. Today, Pearson Ravitz serves the medical community in all 50 states. At Pearson Ravitz, they understand the unique concerns of physicians. Physician-founded and physician-focused, Pearson Ravitz builds human connections before they create quotes. Life can change in an instant. It's hard to imagine that a sudden illness or injury could leave you and your family in a devastating financial situation. But with a little planning and guidance, you can prepare for every possibility. Visit PearsonRavitz.com today to schedule your consultation with the Pearson Ravitz advisor.
Finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo and no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
Hello, everybody, and welcome back to another exciting week of BS Free MD podcast with your co-hosts, Tim and May Hindmarsh. Tim Hindmarsh, the doctor who just had to spend Father's Day water skiing, a passion he loves, even if it meant going in 50-degree weather in the hail and rain in Oregon. He loves it that much.
But the water wasn't cold.
So this week, we invite you to tune in for a fun show that we are doing with Dr. Susan Landers, a retired neonatologist, talking about the importance of support systems for working moms, not just physicians, but any moms. And, you know, working moms can do it. And that's the message that Dr. Susan Landers wants to convey through her book, So Many Babies. And in her more than 35 years of practicing neonatology, Dr. Landers has seen firsthand the challenges that parents face with their newborns when they're admitted to the NICU or the neonatal intensive care unit. And she knows that it can be a big shock and trauma for parents, especially for working moms who are trying to balance their career and family responsibilities. And we even get into the nitty-gritty of breastfeeding as well and the challenges with that. So this is a great show, and let's get into it. So welcome to the show, Dr. Susan Landers. We're so excited to have you on with us on BS Free MD today, just to talk about some highlights of your career and sort of what you're doing now to help other women, not just physicians, out in the workplace. So thanks for being here.
Oh, my pleasure. Thank you for the invitation. I love what y'all are doing.
Well, thank you. As I shared with you on the Match site, like as soon as I saw your bio and the whole thing of getting to retirement and just struggling with burnout and being overwhelmed, and where you've been, and I said, oh my gosh, I feel that we're twinning here because I'm struggling with the same things. I thought it would be great to have you on because I know so many other not just physicians, but women are feeling all the pressures of trying to do it all. And it's so tough. So before we get into that, though, what I really want to do is touch on your career. It's more than 35 years as an NICU specialist, neonatologist. And you have a book out that you wrote that's on Amazon called So Many Babies, where you just share about some stories. So tell us a little bit about that, how you kind of look back on your career and summarize that all up in a book.
Oh, yeah. I practiced neonatology for 34 years, and I loved it. Even though it was a very demanding specialty, it was equally rewarding. And I got to know patients' families and love that part of it. You know, if you have preterm triplets at 24 weeks, those kids are in the hospital for 6 months. And so I got to know the parents very well, and I felt like I was part of their family. After I retired from my long time career, I sort of waffled around looking for something to do that made sense. And some friends suggested, because I always tell NICU stories, that I write down some of my NICU stories. I contacted parents of my patients and asked their permission to tell their baby's story. And every single one of them said yes. And I said, well, I'm going to tell all the details. I'm not going to use your name, but I am going to tell all the details and all the troubles. They said, fine, do it. Great. So I started out to write NICU stories that I thought would let people know what it was really like to have a baby in the NICU. You know, only 10% of newborns go to the neonatal intensive care unit. And it's really scary. It's a big shock for parents. It's a big trauma. And a lot of parents have a hard time with it. Some stays are shorter, some stays are longer. But I wanted to choose some stories that really exemplified how you can do very well in the NICU and how you can do not so well. For the nurses, the parents, and the doctors. Then I threw in my own stories of being a working mom. Again, a friend said, well, you're always talking about trouble with your kids. Put that in there too. So I wove the two narratives together, me at work and me as a mom. And of course, if you're a working mom, you know this, May, and your listeners know this. If you're a working mom, you're doing both at the same time, many days. You might be in the NICU, but your sick kid at home is being cared for by somebody else, or you're at home enjoying the kids and you're really worried about that baby that's having this super specialized surgery, your patient that you want to know how they're doing. And so you don't really turn it on and off. You'll put something on the back burner for a while, but you never really turn it off. And so I chose stories of my being challenged as a mother, because that's what I talked about with my friends when I was a young mom. How do you deal with this? What do we do? I mean, what's this kid doing? What should I do? And so I put all those challenging stories in the book. And so the whole thing is this memoir. It is my life experience. And everybody who's read it says, oh, it's so reassuring to other working moms that, you're a pediatrician and your kids are still messed up too.
I love it.
Yeah, I said, I think we all have messed up kids and we all try to do our very best. In the NICU, when I was making rounds at night, somebody would ask me about a sibling acting this way or that way. And I'd say, oh, my kid did that too. And they go, oh, I can't believe you have children who have problems. We all have children who have problems. And so my book is meant to be reassuring for working moms, especially career moms. But any working mother has to make sacrifices, which is what I did. And I'm sure it's what you did, May. And so the book is written to be a little bit of approval to other working mothers to hang in there. You can do it. It's hard, but you can do it.
I love it. No, you're absolutely right. I remember we made choices, and both of us being, you're in a dual physician household. Right. Your husband's a doctor, just like the both of us, we had that understanding, and Tim, he got it, because he's a doc too. And I, had his support, but we had the understanding that I just personally really wanted to be the mom, to be there for the kids more than he didn't want to be the stay-at-home dad, which a lot of men wanted to take on that role, which is fine as long as you acknowledge it. But someone has to kind of sometimes be the go-to person for the kid problems. Sometimes it's equally split. It depends on the career. But for me, it was me. We decided just the way it panned out for us, it would be me. And so whenever the kids were sick, it would be me. And you're right. I always felt like a yo-yo, as I described it. Or I said I had this sort of bipolar, to use the term, thing going on, where when I was doing the thing with the kids and I was worrying about my practice, because it was in the time when there was not big career sharing or
Right.
patient load sharing. And so I would worry about that. And then when I was at work, I would worry about the kid situation. And you're right, there's always calls and things happening. And it's a phenomenon, I think, for working moms in general.
It is. It is. I was lucky being married to a pediatrician. So when I was in call in the hospital at night, my kids were at home with a pediatrician, and he was good. He was good at bathing and bedtime and books and the whole thing. And he didn't get scared. I will remember the one night, I think he had just turned 41 or 2, and he called me frantically in the NICU. It was 2 a.m. He said, "I can't tell the Tylenol dose, and Ann has a fever." I said, "What do you mean you can't tell the dose?" And he said, "I can't read the label," because he hadn't had his readers yet, his bifocals. And, so that kind of stuff is just normal people stuff, taking care of kids when the other spouse is at work. But in our family, he did all of the grocery shopping and cooking. I'm not a very good cook. I can cook about 10 things, that's it. But I did everything else like you. I was with the teachers and the coaches and the costumes and the plays and the school desk and the pediatrician and the orthodontist. And I wanted to do that stuff. I wanted to be a hands-on mom. It sounds a little paradoxical for an ICU doc. And when I joined my all-male practice in 1997 in Austin, Texas, every one of them was married to a stay-at-home mom. And they're all lovely, wonderful people. But those guys never had to do anything with their kids. Their wives took care of everything. And when I said, "Can we relook at the schedule and start at 8 o'clock instead of starting at 7? Because for me to get here at 7, I can't feed my kids breakfast and get them on the bus. I have to not see them in the morning." And they grumbled, "Well, we've always started at 7. I said, "Well, let's try it." They liked it. They liked starting at 8. They came in and said, "I kind of like seeing my kids before school."
Imagine that.
Imagine that. Yeah. So I did have to bring, as a woman in an all-male practice, I did have to bring family-friendly things in. Nowadays in medicine, I think women have already entrenched practices enough that people know if you've got a sick kid, you're going to get somebody to cover for you, and then you're going to scoot to take care of your sick kid. That's hard to do in an ICU, and in an OR, it's probably hard to do too. But we make it work because we have friends and support systems at work among our practice colleagues. But it's still not easy, and being married to someone who understands what you're going through is icing on the cake, I think.
Yeah, it's interesting because the demographics in medicine have changed significantly. Like I think for the last almost 10 years or so, medical schools in the United States graduate just slightly more women than men, actually.
Yeah. Mm-hmm.
So, it has huge consequences. Some of them are amazing. Like, hey, come on, guys. We don't have to get up at 4:30 in the morning and be rounding on patients for 3 hours before we go to the OR at, 7:30 and, all of these kind of ridiculous things. But, women also tend to work less total hours because they want to be able to be, the mother that's home and does all of those tasks that you described, which, which is a challenge in a system where you have specialties where you have to be 100% on.
Right.
If you're a trauma surgeon, you're in the hospital just waiting for a disaster to happen.
Exactly.
There's no, I got to leave for 5 minutes,
Well, and those of us that are privileged to be able to hire somebody who is going to be there in case of an emergency. And maybe having more women in medicine has made us softer, gentler, kinder. Women take more time with patients than men do. Women talk about feelings more easily than men do, I think. Although I'm not sure I don't think they make the same salaries. I think they still make lower salaries because they're willing to work less hours.
Right.
Than men. But I think I think women in medicine have softened the general specialty for the better. I am worried that women are going into medicine specifically to work part-time. I have a lot of general pediatrician friends who love working 3 days a week. And I say, why'd you go into medicine to work 3 days a week in the clinic? I say, it's the perfect life. It's really, I get to see my kids 4 days and I get to see patients. And I say, well, I wouldn't have been happy doing that. Maybe there's something wrong with me. Maybe I like working too much, but they're very happy working part-time.
Well, I was one of those people that did that part-time work. I would work 3 days a week. I, though, struggled, and my story is a little different because I got to the point where I wasn't even sure that I wanted to continue off through internship or residency. And I'm like, I don't know if this is right. And there's a lot of whole psychology behind that decision. And I had health issues too, that really limited me or would impact me, from severe migraine to I had this horrible bout of mono that put me down for 8 months actually in medical school, and then changed my immune system. And so I wanted to be a plastic surgeon, and I did a 6-month rotation in it, and then quickly realized, oh my gosh, I can't be at the hospital at 4 a.m. for rounds. I'm not going to make it with this little of sleep that was required at the time. And I didn't even know that I was going to make it through like what was required in internship, 36 hours with no sleep every third night. It was tough. And so for all these various reasons that I won't go into more, when we started, I said, maybe I should just work 3 days a week and see how much I like it, and go from there. And for me, that worked, but it was tough.
Good.
It was tough because it wasn't the same as being there full time, and it was not, there's no job share. So I had to make it work for my patients and my practice. And I was in a little group where I didn't quite get that support from the male colleagues, and there was no other women, and we're in rural America. So I had to kind of figure it out on my own. Now, as time evolved, that all changed, but I struggled because I always felt like I wanted to be there more for my patients. And then we started having a family, which, we talked about. And then I wanted to be home with my kids, and we did have a nanny for a while. And then as they were older and in school, we didn't need the nanny, but then, they get sick. And then, so for me, it did work out just because there was, kids were sick. There was events. I felt like I was still being played back and forth between my patients and my kids. And it was tough. But I did yearn to have that career where I could be there full time and advance, like the men did, and I didn't. And so in my head, I had to say, you know what? It's okay. It's a choice that I made.
Right.
To do this part-time. It's a choice I made, to take the time off with the kids. There was no maternity leave. I had to quit my job and get rehired, which I just shared about, which I don't know what it was like for you, but so it was a conscious choice. But had I been able to, I really wanted to try to be that full-time professional.
Well, and I mean, but it's amazing how much stuff has changed even in the last 25.
Oh, yes.
Even in the last 15 years.
Yeah.
I mean, we had a manager, a physician manager, a medical director, because May had one of our kids who, I don't know, I forget what he had.
He had ear infections. He had an ear lot.
And so
I would bring.
So he was completely well behaved. He was 4 or 5 years old, and he was just sitting in the corner coloring or whatever. And one of the other docs, got upset, and so the medical director comes to May, and this is like 2005-ish, 2004, and says, you just have to choose between your family and your carear.
That's what I was told.
Yes. And so she said, guess what, genius? Guess what I said. Guess what I'm picking? That's an easy choice.
Yeah, that was 2009, because I remember, because I pulled the plug, and he said, you can't. The other practice down the hall was a bunch of internists with a geriatric population, and they saw this sick kid in my office, and they didn't know he had an ear infection. That was it. But they're like, there's a sick kid, and she's bringing him to work now and then, and we can't have that. And they complained, and so they said, you can't, have your sick kids here. I'm like, well, the nurses do. But anyway, besides that, but you have to choose. between your family and your career. I said, you just said that to me. Then I choose my family. I'm done. Goodbye.
Well, I think working moms in any field have to make those choices, and we juggle work and child care responsibilities no matter what we do for a living. I mean, you're always sort of driving home to take care of an issue, or calling home, or arranging for somebody else to be there. It's just the nature of having a family.
Yes.
And I think workplaces are finally getting a little more family friendly. If there was one good thing that came out of the pandemic, it's teaching people that working remotely from home so they can make sure their kids are okay actually works. And it's really interesting to follow all these business postings about whether it's good or bad that people are not in the office.
Right.
I mean, when you're a physician or a nurse, you can't not be in the office. When you're there with your patients. But in business, they're really struggling with whether or not women and men are meant to be in the office all the time, or whether it's okay to be at home and overseeing what's going on with your kids part of the time. I think that's a good thing.
I agree. In fact, we talked about that quite a bit, and I'm like, it's almost swung the opposite way, where it's like, don't people just need to kind of get out of their house more and go back to an office and socialize with other people in person? Just like we recommend for kids to have social time with one another. And so always being in your own box at home is maybe not healthy either. And there's got to be a balance. But I love that we're talking about this, as we mentioned earlier, on our show. It's not all directed to physicians or medical people, but this affects everybody, no matter what workforce or workplace you're in, whether you're a female or male. If you have a family, which most people do, you've got to figure out balance and who's going to be the primary, or if you're equally going to split the childcare duties, and how to do that. And we always said it's something you need to negotiate or renegotiate as time goes on and the kids get older, and talk about with your significant other. It's just a thing that you have to plan and work through. But
right. I agree.
Yeah. So I know, since we're talking about this, I want to dive into a little bit more on this. And I know on your Instagram page, you have some really awesome tips and thoughts on how to deal with workplace life balance, especially for women, and the struggles. And so what do you have kind of in your head, like the top sort of 5 tips that you think of or that come to mind, or fallacies about work-life balance that you kind of focus on?
Yeah, I do. I think that working moms are allowing themselves to be burnt out for a couple of reasons. The juggling, the struggling, what's at work and what's going on at home is hard for all of us, but I think we're working harder to get some sort of recognition for what we do. And women are still paid a little bit less than men, and they don't like that. But for whatever reason, moms get burned out. They tend to take on so much responsibility. I'm hearing that they take on working full time and having 2 or 3 children, maybe a special needs kid. God forbid, being a single mother, those women are saints. That's so hard to do. But they're not asking for support from their friends and neighbors. And we don't live close to our families anymore, so you can't get as much help from your mother or mother-in-law. And we're looking at each other on social media, which gives this totally irrational view of a life that's impossible to have. Social media exposes working mothers to something that's like perfect households and perfect children and cute clothes. And they get this notion that they're supposed to be able to pull all this off. The laundry, the meal preparation, the cute clothes, the school functions, working full time. not having a friend at work, not taking care of themselves, and they're getting burned out for all of those reasons. Maybe there's some extra ones that I didn't list in there because lots of things weigh on the mental load of working mothers. I think the main cause of this is we have forgotten when we're working mothers how to take care of ourselves. One of the things I learned begrudgingly in the first 10 years of my being a mom, you probably did too, May, is that I could not work full time and be a mom full time and leave myself on the bottom of the list. I had to learn to put myself on the list. I had to learn that going out for a run was really good for me. I had to learn that meeting a friend for coffee and sharing struggles really built me up and helped me feel supported. I had to learn that taking a break, going outside and sitting outdoors was good. You know, making some space to think about what I was doing and what I was worried about and what kind of mom I was being. So that's 3 things right there: exercise, being outdoors, making space for yourself, getting in touch with your friends, feeling the support of women that are going through just what you're going through, working on your relationship. So I had to learn to do all those things. It's not easy being married to another doctor if you're a doctor. It's not easy being married to a worker if you're a busy worker. It's hard. You're both working. And so you have to take care of your relationship and your children and the house. And we're not putting ourselves on that list enough. And so it took me about 10 years, I think, the first 10 years of being a mom, to learn how to take care of myself. I was in a great support group. A Methodist minister who was also a psychiatrist convened some medical couples. There were 8 of us, so 4 couples, he and his wife. And we met every other Sunday night, and we talked about issues and parenting and being doctors and being married and all of those things. And it was so helpful for me to hear that other people had the same struggles and to hear what other people did for solutions. It really made a difference in my life as a working mom. And that's when I learned that if I didn't take care of myself, I was going to get totally fried. So the things that I post on social media are just little tips and tricks that I used as a working mom to stay afloat. They're not all perfect and they don't work for everybody. Like, I never did meditation. I never could really learn how to do that. But I write in a journal now. I didn't used to when I was younger and busier, but I love it now. I've always been an exercise nut. I've always felt like exercise boosted my mood. And when I felt fit, I felt like I could do more. And so I just see all these working moms sort of stuck at home and folding the laundry and not taking care of themselves. And it's breaking my heart because they think they're supposed to be able to do it all, and they can't. Nobody can. We were just talking about how hard it is. You cannot do everything.
No.
Yeah. And that's, I mean, that's just a fundamental principle of life, which is, you know, every single thing in life is a trade-off.
Mm-hmm.
It's 100% a trade-off. You know, May and I have been super active. We both, I mean, I run a bunch of marathons and a lot of action sports and going over the handlebars, dirt bikes a million times and a whole bunch of skydives and on and on and on. And now, you know, you get used to that. You get used to that level of activity. Well, now stuff starts to break. So how do you deal with injury when you've never dealt with injury before? You know, May's had a bunch of orthopedic injuries, and it's just like, well, because everything changes and you have to change with it, and you can't, you know, it's a trade-off. So the trade-off of being super active for the first 50 some years of my life means that, you know, you may have different injuries that you didn't have, but, you know, and so everything is a trade-off, and people don't want to understand that. They don't want to it's I call it the Oprahfication of the nation, where it's like, you can have it all, speak to the universe, and you will have, the perfect family and the perfect career and the whatever. And I'm like, if I really believe that, who would empty the porta potties?
Yeah. Tim, that's a great point. I remember I used to love running, and in my 30s, I would strike out when I was home from work and go for a run, and Philip was fixing dinner and the kids were doing whatever. And but then I got to where I couldn't run. And so now I'm really into Pilates and bar. And since I'm older, strength training. And you said what I did and what we all do. I adapted. I found some other way to keep my mind on the happy side instead of the overworked and depressed side. And there are lots of different ways to do that. You do not have to run 3 miles to feel good. You can take a walk outside around the block, as long as it's green or mostly green, and as long as you're out of your house. That really, really helps. And so adapting your circumstances to where you live and how much time you have is just crucial for people to learn how to balance work and family.
Yeah, the point that I always hit home on as well is, and you hear it kind of overused, but I love it. It's like, if mom doesn't take care of herself, or if you don't take care of yourself, no matter who you are, you can't take care of others that well. If you're not well, how are you going to take care of others? And so I always would get mad when they have these TV shows to lift people up, and they get a makeover or whatever. It's like, oh, they always put everybody else first. They never do anything for themselves. They're so great. I'm like, well, that's sad if they are never doing anything for themselves.
Right.
So you kind of martyr it. But I have a couple of people in mind, and I just harp on them all the time. Like, you're doing things for everybody else and work. You got to take care of you. Now your health is suffering. You want to be around for your kids. You have to carve out time, and there's always the excuse, well, there's no time, there's only so many hours in the day. And I'm like, well, something's got to give. And I would also talk to people about this balance, and I would reference it like myself feeling like my psyche or my life is an elastic band, and something's pulling at it in different directions. Work is one way, kids and family another, some of my wants another, just all the facets of life pulling this elastic band in different directions. And if something's pulling too much in one way and something's pulling too much in another, and I'm letting it control me, it will snap. So that is, burnout or a crisis. And so you have to keep that elastic, balance. And sometimes in life, as what Tim said, we all adapt and change, but sometimes, yes, it will pull you more in one way than another. With a newborn, you're at home and you're feeling horrible. Your body's feeling crappy and you're tired. And yes, it's pulling you one way. And in other points in your life, maybe it's career, it's going to pull you maybe a little bit excessively one way because you're trying to advance and you need to put that time in. And so, yes, you have to recognize that things will suffer. Maybe you're working out a little less, or your kids aren't going to see you as much, as long as it's conscious choices that you plan out. But that elastic is going to go or snap if you don't kind of keep it in the round and keep track on it.
My husband was a great barometer for me. He was good about saying, you seem to be pretty stressed out about something, or boy, that was a big reaction when David said so-and-so. And I gave him permission, and my children too, as they got older, to say, Mom, what's going on? Because I tended to bring a lot of my NICU stuff, worries about the babies home with me.
How do you not? How do you not? Yeah.
So they would say, Mom, are you okay? Do you need to go take a walk, or do you need to go sit outside? I swear to you, I gave my kids permission to say that. And
that's their way of saying to you, get out of here. You're bugging.
Get out of here. Your rubber band has been pulled too tight. So, and the other thing that I don't think younger women are doing because of social media, We're not talking to each other at work or on the phone. We're texting, we're scrolling. It's not the same as talking with a friend and saying, this is really bothering me. I don't know why he's doing this, or I don't know why she's up to this, or did you ever deal with this, and how did you handle it? I feel like the support we get from our friends is becoming less and less important, and it needs to be very important. It is a big deal. Whether you're getting support from a partner or a spouse or from a good friend, those things are crucial to keeping yourself afloat when you're trying to work and be a mom.
I love it. And it's so true. And, reality check, even for people like us who are more older and wise in age, I get on that social media and I've unfollowed a few people. They would drive me crazy, and they might have good hearts. I don't know what their life's really like, but I see exactly what you said. Clinic outfit, it's their Louboutin shoes and their fancy designer outfit that they've all tagged and labeled. And then they show them working out in their gym with their young 6-year-old kids and their spouse that's a professional as well. And then it shows them on TV, and then it shows all this stuff. And I'm like, how on earth? I can't. And then I'm like, I gotta quit following these people because I'm not getting anything out of it other than frustrated. And I'm thinking my life needs to look like that. And is it really reality? And even if it's their reality, it's not helping me. So I agree that social media is replacing the real, true people in our lives that need to be there physically for us, as well as a substitute. And so it can be so damaging. There's so much helpful stuff on the internet, but yet these false realities and personas and even how we interpret them, that's not helpful. So I agree. Why don't I want to shift a little bit and talk about the breastfeeding part of things, especially in the workplace, because that's a big passion of yours and has been.
Right.
So you were part of the breastfeeding, what's it called? Breastfeeding Academy of Medicine or Medical Breastfeeding Society. I didn't even know.
Yeah, she did.
I'm like, there's an Academy of Breastfeeding, and
there's an Academy of Breastfeeding Medicine, and it was created because pediatricians and obstetrician gynecologists and family practitioners about 15 years ago were not getting the kind of training that they needed to help nursing mothers in their offices. It was kind of right on the cusp of all this effort to get a help from an LC, a lactation consultant, and a lot of people have hired lactation consultants in their office. But pediatricians were trained to give formula, and obstetricians were trained to say, talk to your pediatrician. And I don't know how family practitioners were trained, but we all got some bad information about how to help breastfeeding mothers. And even though 80% of mothers choose to start nursing in our country, only about 30% make it to 6 months breastfeeding, and fewer than that are exclusively breastfeeding. And so the Academy of Breastfeeding Medicine said, we can do better than that. We can take pediatricians, obstetricians, family practitioners, and we can train them in the best ways to take care of nursing moms and babies. And then that information will filter out to the other practitioners. And they've done that. They have worked with ACOG and with AAP and AAFP, and they've helped develop guidelines and tools for physicians to learn. They've worked with lactation consultants, and they've brought breastfeeding into NICUs. They've brought breastfeeding into hospitals. So they've done a lot of good, but it was recognizing that American physicians did not really get from medical school through residency proper training in breastfeeding support. Things are different now, and pediatricians are LCs. They get themselves trained as LCs, and they can advertise that they're baby friendly because they're also an LC. And I became interested in breastfeeding medicine because it was so difficult for mothers in the NICU to be successful at that. They had to pump their breast milk for days or weeks. We had to figure out how to help them do that in an effective way, how to maintain a milk volume. Then when their premature babies got old enough, we had to figure out how to teach them how to nurse. They could barely suck from a nipple and a bottle, but it was different to learn to nurse from mom. And so I became really interested in this whole notion of supporting breastfeeding in the neonatal intensive care unit. I had a great opportunity. It was really just serendipity. When we moved to Austin, there was a milk bank called the Austin Mother's Milk Bank that pasteurized donor human breast milk and released it with a doctor's prescription to hospitals in and around Texas. When I started working there as a medical director, there were only 8 breast milk banks in the country. Now there are 28, and lots of people have heard about donor human milk and the benefits of donor human milk for babies. But I got in on the cutting edge and learned about donor milk banking and learned how donor breast milk benefits premature babies, so that when moms can't pump breast milk or are unsuccessful or take a medicine that precludes it, now we know that using donor breast milk is just about as good. And so I was just really fortunate to be in that area expressing interest when all that milk banking proliferation occurred in our country. Having said that, a real interesting thing that's happened in the last few years is donor milk sharing on the internet.
I was just about to ask about that.
No, that's just that my mind goes to some very, very bizarre places. As soon as because May and I were talking about this before we started the show, and I'm just like, there's people on like Facebook Marketplace saying, I have extra milk, and I'm like, no, please, just no. Just don't do that.
No, strongly no. And we need to tell the public why it's a big fat no.
Yeah, let's do that.
You have no idea if it's collected in a safe manner or stored sterilely, and how it's refrigerated, and is it transported on dry ice, and what medicines is the mother on, and has she been screened for syphilis, gonorrhea, hepatitis B, hepatitis C, and HIV. And that's a lot that you do not know about the donor mom on Facebook or on the internet. And a lot of studies have been done showing that milk is contaminated, and get this, that it's diluted with cow's milk.
Oh, horrible.
So they can sell it. Some people are selling donor milk on the internet.
So
it's very dangerous. Very dangerous.
I know that you're right. Recently, with I think was it all the shortage, right, of the formulas out there. Right. I mean, I go in this Facebook Marketplace and I sell things, household items and junk, and we've moved
books,
books and old frying pans and rug and a plant, and then just talking. I'm seeing it online, but also then talking to other friends of mine who have kids now in their 20s that are starting to have kids, hearing about this, and that, oh yeah, so-and-so's got a shortage and so-and-so's got an excess and they bought some from somebody on the market. I'm like, what? Are you kidding me? So that was was the first thing that came to mind. It's like
drug deals out of the back of a van, but it's breast milk. And I'm like, are you kidding me?
It's not quite that bad, but it can be. I mean, a baby could catch HIV or Hep B or Hep C from contaminated breast milk. And no mom, regular old mom, even if she's your neighbor down the street, has any way of knowing if she's positive or negative without the testing.
Now, if they've had it, say someone is like, oh, I've had all the testing and I'm healthy. Yeah. Still, they don't know that you're right. I mean, how long can you have that breast milk out of the refrigerator and the temperatures before it's starting to get contaminated with bacteria?
Right.
to impact that other infant. And
Yeah,
if you don't, I was going to say, if you don't know how to store it and how long it has to be refrigerated, I mean, I think a lot of people don't even know how to take care of their own breast milk.
Right.
Let alone.
You're right.
So
now there are guidelines on the internet for the answers to the questions you just asked.
Right.
When you're pumping your own milk, and perhaps your neighbor is following those guidelines and you trust your neighbor that her prenatal tests were negative, and she tells you she's not on a medicine that would contraindicate breastfeeding. There are very few, but still it's a risk. And I just want people to know that you cannot talk to somebody and figure out whether they are a high-risk donor or not. You think you can, and these websites tend to advertise that it's a, what do they call it? It's called assent instead of consent, that you can talk to a donor and they give their assent and you accept them being a donor for your baby. The whole thing is fraught with problems.
I think we're trying to go back to like the dark ages when you heard about wet nurses all the time and just think, oh yeah, they did it in the 1800s, so we can do it now.
But unfortunately, you owned the wet nurse in that.
Right.
So it was kind of, it was a household employee or worse. So it was a little. So
yes, I'm glad we talked about that, because what's happening now is frightening, and even in people where I think have a bit more education and common sense.
Need to be very careful.
Yes.
Right. They need to be very, very careful.
Let's talk a little bit about the challenges of breastfeeding for women. I can say that on my podcast.
So,
challenges for breastfeeding,
because we aren't going to talk
women.
About the breastfeeding challenges for men.
No,
I'm sorry, we're old school.
It popped in my head and made me laugh. But challenges for breastfeeding and pumping for women when going back to work, because I know. It was a challenge for me. I'm like a doc, and I'm like, oh my gosh, I have to take time and find a place and a spot to do this, and then how do I store it, etc. So, thoughts on that and going back to work, and you're trying to continue breastfeeding, want to pump, store milk. Any thoughts? I know I'm thinking if as a professional, it might be easier because you can plan your schedule, take breaks. I'm thinking of the poor person that works at the local grocery store behind the deli counter, where it's like, no, your 15 minutes is from 10 to 10:15. That's it. So how do you advise on that?
Well, thankfully, the law has just been approved called the Pump Act. I read a post on Instagram by an attorney saying that provided women in all fields with 1 year of protected time to pump once or twice during their shift at work, and the employers were required to provide a separate private space and access to running water and soap and access to refrigeration. So that act, if that's all true, the Pump Act is going to make a huge difference for moms who go back to work and are trying to maintain a breast milk supply. Most folks who don't have employers who provide those things, and if they don't have an electric hospital grade pump, don't make it when they're back at work. A lot of us don't make enough milk supply when we're back at work because we're stressed, we're not pumping, we're not nursing, and our breast milk production goes way down. That happened to me with my first baby. I was in tears at 10 weeks. I went back to work at 6 weeks, and I couldn't pump enough and leave the NICU and go and express milk. And so I didn't nurse him any longer than 3 or 4 months. I was determined with my second one to do better than that. And she and I made it 6 months, and it was still a huge effort for me to say, I've got to go pump. I'll be back in 20 minutes. Now we have double pumping. Back then we only had single pumping, so it took twice as long. So now with good pumps and double pumps, you can pump both breasts at the same time. It's easy for moms to express their milk in 15 minutes. And if they do it properly and store it properly, that's a reasonable break, 15 or 20 minutes. And if that law really does protect women and allow them to speak to employers and HR managers about those provisions, it's going to do a lot of good. Because going back to work is the hardest thing for breastfeeding moms. It is the big hurdle that causes nursing to fall off in the first few months. My own daughter had trouble with it, and she had a great supply pumping, and she's a pediatric ICU nurse. And when she went back to work, of course, her supply went way down. I said, how often are you pumping? She said, oh, once during a 10-hour shift. I said, that's not enough. Your baby would feed 2 or 3 times doing a 10-hour shift. And she said, oh, I never thought about that, Mom. And I went, okay, you got to pump at least twice. Things like that. It's really hard for some women in some jobs to take enough time to peel themselves away from what they're doing to express their milk. But it is mandatory if we're going to be able to maintain a supply and keep nursing our babies. It is a hard, hard job. Going back to work when you're nursing, I think, probably it was for you, May, like it was for me, one of the hardest hurdles to get over.
Yeah, I actually mirrored your story exactly. With our firstborn, I think it was 3 months. And I remember just trying, and you're right, you've got all these emotions and thoughts going, and to just shut it off, to relax, to allow your breast to just even be able to be pumped and let down the milk. It was just a struggle. And so then the second time around, I thought, oh, okay, I think I got this a little better. It was 6. I went to 6 months, and I'm like, oh, wow, yay me, double. But that was the end. And then I was working, and that was the end. And I just kind of thought, I never even thought about, I'm going back to work, and it's the stress of the work and how much that impacted, because I tried. And that's important, I think, for women to know. I just chalked it up to, I just didn't produce any. I was just a poor producer, and that's what happened. But for women to know that, yes, that work makes it very difficult, and not as a reason to not, go to work, but to be aware of that, and to make it them understand, to try, but accept that if they then are unable to produce anymore, that it's okay. As long as, because there's a lot of guilt and shame, and and I had a lot of friends that were stay-at-home moms, and they were nursing their kids till they're 12 months, 13 months, and then switch over. And I'm like, oh my gosh, what's wrong with me? I'm a doctor. I should be able to figure this out. And then I would say, well, I guess it's just the way my body's made. And that's tough, because
it is.
Yeah, the guilt, I kind of want to address that, because breastfeeding is clearly better. It's better for a whole, like myriad of reasons. But there are times when it just doesn't work. And, I've sent women to lactation consultants, and they really want to do this, and they come in, and because I had a very busy obstetrical practice in my family practice. So I had the privilege of following these families on, all the way through their delivery, plus taking care of the infant, and they would feel like their kid was going to become a serial killer if they didn't, nurse them to at least 6 months.
Yeah.
And I said, look, here's the thing. Okay. Your baby right now is so hungry. It's just irrationally crying all the time. And we tried this, but for the sanity of all concerned and for the health of your infant, you just that's why there's formula. It's plan B. And sometimes and it's still good. Is it technically as perfect? Of course not. Breast milk is it's the perfect human food. It was made perfectly for little humans. But plan B sometimes is really awesome. And I'm really glad there's plan B, and just do plan B, and you're still going to be a great mom.
Exactly. And May and I both used plan B after 3 months. So
Yeah, and
A
our
lot of
Yes.
babies do fine on formula, and moms feel relieved that they don't have the pressure to have to perform when sometimes it just doesn't work. I mean, you're right. And some moms struggle so much with triple feedings. They nurse the baby, they pump their breasts, and then they feed the baby express milk. 3 feedings, and then they do that every 2 or 3 hours. It is insane what we ask some of these parents to go through. And in the name of breastfeeding, yes, but it's not worth discouraging a mom. It's not worth shaming a mom. Formula is fine for the nutrition of babies when breastfeeding doesn't work.
That is a great message, because we've seen this on social media where, some of these women, they have a little bit lighter schedule, or they're stay-at-home moms, and that's all great. And it's like,
It's their platform.
it's like they're, this is their social justice warrior thing. And I'm like, come on. I mean, and then you see some of these women that are single moms and they're working and they're whatever. And I'm like, that's just sad. Like, don't shame people over this. I mean, it's just,
I know. I say, hey, I was raised on formula, the crappy kind, from the 60s, was like corn syrup, and I don't know what, all that.
It's like Nestle's Quick.
It was. And I'm like, I turned out okay. My IQ's pretty good, so your baby will be fine.
Yeah,
and,
me too. I say the same thing. I was raised on formula. But there's another thing about it that's really weird. I was nursing my 3rd one, pumping milk in the NICU, and she was almost a year old. And I had been on call for 24 hours, and I was walking with a little container. I guess it was like a carton where you could put a 6-pack of beer. And I had my pumped milk from the previous 24 hours in there with me. It was a lot of milk for 11-month-old. And one of my friends, another physician, said, "What's in there?" And I said, "Breast milk." He said, "Why are you still doing that?" And I went, she's only 11 months old, and it's finally working. It's finally like I know what I'm doing on the 3rd child. He said, "That's silly." I went, "Actually, I really like nursing my baby. It's not silly." And I thought, he made me feel bad for still wanting to breastfeed. So whether you can't, or whether you can, or whether you do or don't, we've turned it into this social construct. You're right, Tim. It's like, to be the perfect mother, you have to breastfeed exclusively for 18 months to 2 years. I didn't have that life. It wasn't a choice I had. I would love to do that. But I don't want to make anybody feel bad about taking care of their baby. That's my bottom line.
Yep.
Nutrition and mother's health are the 2 things that I emphasize when I'm caring for breastfeeding moms and babies.
No, it's perfect. I love what Joan Rivers said. She said, you breastfeed them for 12 or for 18 years and let the girlfriend take over after that.
That's cute.
Oh my goodness. So back to the whole, struggles in career and in general, aside from trying to breastfeed and manage your sickly kid. And I know you have an ebook out, right, for moms, as well as the one about your memoirs from the NICU. And I forgot the name of the ebook, but can you tell everybody about that and where they can find it about?
Yeah. I actually have 2 ebooks. One is called Conquering Burnout.
Yes.
And it's a little bit about my own story and the methods that I use to get better. And then I have another one called Understanding Your Mom's Stress, where I go into more about what causes us stress at moms and how to recover from that, how to handle that stress and recover if you're burnout. Both of those books are available on my website and can be purchased through Amazon as Kindle ebooks. And I have other free resources on my website, a wellness journal, hacks for burnout moms, a quiz that moms can take to see if they are burned out, a self-assessment questionnaire. So I've really developed a lot of tools and put them there for free. The ebooks are, I charge just a small price, like I think it's $3.99, something simple like that. And they're available. My website is susanlandersmd.com, and people can go there for free resources to get ebooks. I have a blog there where I write on lots of different topics. May, one of the things that I've found being an older doctor, now retired, is I can pretty much have opinions about anything I want to have an opinion about. And so I do a lot of research and reading, and then I'll write about something that I think is important that has to do with children and moms and working moms. And so my blog is about, I guess it's wisdom and experience, kind of my viewpoint on what's going on in the world of working moms and children's health. So I recommend my blog too for people. I have a newsletter that I do. Again, I've just been trying to support working moms who are trying to make it all work, who have lots of questions, who want a little bit of reassurance. I even let people sign up for a 30-minute consultation because I'm just that kind of person. I really like to chat with people, ask them what's going on, talk about what some of their issues might be. I'm not a coach. I don't do coaching.
But you're a coach. You just don't know it. I mean,
oh yeah. Thank you.
To me, I'm thinking, part of me thinks I would love to do that. And then I think the reverse happens in my head is that a lot of us who are out of the workforce or not exactly with our hand on that pulse anymore start to think, well, I'm not relevant anymore. I'm not current. Who am I to give advice because I'm not from that generation? I don't understand. But the wisdom of all the life experiences that you and, I've had as we get older needs to be passed down and shared. And so technically, I think, you think you can call yourself a coach because you're just coaching the next generation with your wisdom and providing help to help them figure out their path along the way and passing that down. And I think we need to encourage more people to just forget about the title or the training of being a coach and just say, I'm here to help coach you along. This is, I'm not officially certified, but, but this is my experience. And so I think that I would say, yes, you are a coach because that's what you're doing. You're right. You're not a psychiatrist, psychologist, and maybe you don't have a cert, but you're a coach. And we need more of that. We need, I think,
yes, but can you imagine if healthcare systems actually really gave a crap? And instead of putting us all into a gigantic room, I remember the last time I was for it's a couple jobs ago, and we had been there for a very long time, saw tons of changes, and they have their physician burnout champion, who is another doctor who's at the end of his career. So he's doing all this administrative stuff. So he's not seeing patients and ticking boxes and doing all this completely insane stuff. And their solution was, okay, we're going to show you how to meditate. So sit in your chair and feel your feet and feel your whatever. And I'm like, okay, this is exactly like I got thrown into the worst penitentiary in the world for a crime I didn't commit. And I'm being assaulted every night by the meanest person on the cell block. And you just put up a picture of a beach on Hawaii and told me to just think that I'm there. I'm like, no, you've created this crappy system, and now I'm supposed to meditate. So what if we did this? What if we had people that were retired or semi-retired that actually just spoke to young physicians and said, yeah, I get it. This is hard. Yeah, I get it. There's a lot of stuff that goes on that doesn't make sense. And you didn't have to be official coaching, but you had interactions with older, more experienced folks that still toughed it out like you did. 35 years in NICU is unbelievable because that is a super stressful job. And we built systems like that. So somebody like me with a big fat mouth that will share my opinion gets a job as either an online consultant or whatever to an actual healthcare system. And
Oh,
said,
that'd
you
be
need to go talk
great.
to this guy. And he'll tell
I
you
agree
about,
with you. I
you
agree
know,
with you. That would be great to
instead
really be
of the,
real consultants to healthcare systems.
Right.
instead they bring a guy in that wrote a book about whatever, and they pay him $1 gazillion and he's there for an hour. And I'm like, no, you don't understand. People need to like have discussions over a period of time and understand that they're not alone, and understand that, like you were talking about how every physician now has a side gig. It's like the day they're born as a doctor, they're trying their hardest to not be a doctor anymore. That is horrifying as for us,
it should be horrifying
as we
for the patient
age, because who the heck is going to take care of us?
But also the
I don't know. I'm old fashioned. I went into medicine as a calling, and I worked hard, and I always provided service to my patients and their parents. And I feel really good about what I did. And it was a real privilege to be able to do what I did. I had some tough moments. I had some struggles. There were some ethical issues near the end of my career that kind of sent me over the edge. But, babies with birth defects that were inoperable, but they were being maintained on life support. And, the kind of tough ethical issues with life and death that come up in the NICU with high risk obstetrics sometimes. And so it's not easy. It's not easy in any ICU. It's not easy in any ER. And we all know that COVID brought out the worst in healthcare. But this notion of doing everything for every patient, being everywhere all the time, is not humanly possible. It's just not. And the doctors are suffering. I think young physicians are suffering because they don't know how to take care of themselves in this environment.
Well, and I think, I've said this a gazillion times. Hard work has not burned out a single person. If you got into medical school and you graduated from medical school, you understand hard work. Hard work does not burn people out. Meaningless work burns people out. And in my career, I'm doing a little bit of primary care now, but largely urgent care. And I left it largely because the metrics, they pay you to tick boxes. They pay you to not see a sick patient. They pay you to, just like tick these boxes and make sure. This one example, which we've talked about before, solidifies everything. I got a call from an insurance company, and this was over a decade ago, because I had a diabetic patient and I had not documented a diabetic foot exam on the patient.
Uh-oh.
So
the patient had no legs.
Oh, God. Oh, my God. And the system caught you because, that is unbelievable.
Yeah, like he hasn't had feet since the Kennedy administration.
Oh, my gosh. Yeah. Oh, wow.
And you sit there and you go, I cannot work in this kind of system where I have to worry about stuff that is completely meaningless. And the insurance companies, the federal government, however all this trickles down, doesn't trust me. I'm so dumb, they have to tell me how to practice medicine. And I was like, I'm done. I will go urgent care. I'll see sick people. I will treat pneumonias and fix broken legs and do all that stuff that I, was trained to do.
Yeah. Again, listening to younger doctors who are burned out, I'm hearing that one of the biggest problems in medicine is the electronic medical record.
Single biggest.
The very thing that was supposed to help us is the one that is slowing us down, creating frustration, creating bureaucratic nightmares. My patient notes didn't talk to X-ray, didn't talk to lab, didn't talk to the hospital system. That's 5 separate charts I had to get in and out of to take care of a baby in the NICU. And I bet doctors all over the country are agonizing like that. And patients have no idea that we're having to put in all that data. It's almost like we're secretaries and
We
doctors.
are. I remember the day that I switched from just being able to quickly dictate a chart note or write it down to having to, no, you type in this, no, you order the x-ray, you call the radiology department to click and I'm like, I'm not the secretary. You're right. I would say I'm not the secretary. What happened to my transcriptionist? I was way more efficient. And now you're just, the physicians are burdened with entering all the orders and clicking. And if it doesn't work, then there's always a bunny trail to go down or someone to call. And it's taking away from doing what I was trained to do and do best, which is just see the patient, come up with a treatment plan, be there with the patient, all that administrative stuff.
Well, so this is where we're going.
Crazy, and that's why I had to finally just say
this is where we're going. If you want to believe that the Terminators are coming, I guarantee you this is the direction that's happening.
Yeah.
There is voice recognition software now that's good enough where you can go in and see a patient and it will assemble the entire note for you.
Oh, good.
Okay, but there's a dark side in my opinion, because I actually got interviewed by a person that works in AI where she said AI is getting so good that we're going to make digital copies of people and study drugs on the digital copy and not have to have human trials. Which
what?
Yes.
How could that be possible?
This is honestly the truth. So
wow, that's amazing.
So what's going to happen
is have digital breast milk.
Yeah. So this is what's going to happen. Well, we've already got digital boobs, but that's another story. So
it's a plant food that tastes like breast milk instead of
Bill Gates will make you
it looks like breast
lab
milk, just like meat
produced breast
meat that looks like.
Man.
But this is what's going to happen. So once we get those technologies matured and into the hands of tons of physicians, now we're going to have hundreds of millions of office visits and hospital visits a year, which the machine learning, the AI, is going to be able to collate. And then you are one step away. Once you've collated that, using the voice recognition software is teaching the AI. And then eventually you're not going to see a doctor. You're just going to talk to a machine and it's going to prescribe you a drug. I absolutely guarantee you that's the direction it's going, because from a corporate model, that's the ultimate corporate model. And then the problem is the ghost in the machine can alter the AI so that you always get a prescription.
Yeah.
So
to make the money.
Side.
Well, the AI will not be able to take care of infants in an ICU or children in an ICU because they don't talk. And how is AI going to replace vets? I mean, we're closer to vets than we are doctors because our patients don't talk.
Yes, I always said that.
We have to get all our information from the exam and the labs and the x-rays. And I don't think AI will make it into the NICU or the PICU, but that is sad. If AI is going to take the place of physicians, well, there won't be much burnout then, but it's not healthcare.
No, it's, but I mean, because we've had actually several people that have reached out to us about, the digital technology and AI is the future of medicine, like requesting interviews, et cetera, et cetera. And I've done one interview about it, and I never really realized how advanced it already is and how pharma is already using this to a massive degree. And I'm like, it's just one step. All you need to do is get enough information, and then the AI has the data, and then it becomes the doctor. And that's, I think that's where we'll be.
Well, wow. Imagine that from a premature baby all the way to artificial intelligence and non-human. That's where we've gone in this conversation.
We've covered a lot of territory.
Yeah.
Well, thanks you so much for taking the time to be on our show and share with our listeners just your experiences, and especially the great information about breast milk. And I'm going to put all your links on to your website as well as your social media posts and your books. And it was great having you here. Thank you so much again.
Oh, thank you, May and Tim. It's been fun chatting with y'all. It's great to take a realistic view of where we are in this grand scheme of things called practicing medicine, being human.
Absolutely. Amen to that.
Yeah.
Wow, she was great. I think the thing I liked the most about this show was her talking about the whole business of people seem to be more committed to using medicine as a vehicle to invest in real estate than actually take care of patients. This whole, you're doing medicine to make your best life and all this, which is just, I mean, it's fine. But really the central theme of medicine is a calling to take care of people. And I think we're losing some of that. Also, what she was talking about, the breast milk banking was pretty crazy. I'm thinking that in my retirement, I'll become a teller accepting deposits at the breast milk
A
bank.
teller. Okay. I thought that was.
Can you imagine the automated teller
I
at
thought
the
you were
breast
gonna
milk bank?
say something really just off the wall, especially after our trip to the dairy farm last year, which has come up again in our social media posts, and how you were recently flaunting your milking abilities, or I guess lack of milking abilities.
Yeah, terrible. My breastfeeding is horrific.
Anyway, that's a big diversion that you'd have to scroll back through our social media posts to know what we're talking about if you didn't see that. I think she was very inspirational. She's had an amazing career. She's given so much. Her book, we will link. I just, I differed a little bit and wanted to make sure that, people, and especially women in medicine, didn't feel, not shamed, but if you're not working full time and you're trying to balance a part-time career like I did with part-time stay-at-home mom stuff, hey, I think that's actually sometimes harder than the people that just can unplug and work. And because I always felt like I was a yo-yo back and forth, and it was tough to find the balance. So I always struggled both ways. When I was at home, I wanted to be at work because I felt guilty when I was work. I felt guilty because my kids wanted me more at school or home. So anyway, hats off to all the moms, no matter what you're doing, how much you're working in medicine or any professional career, or any career for that matter. So thanks again to our listeners for tuning in every week, for signing up for our Truth Serum newsletter. And we have a shout out this week to Sandy Kibling. She is an awesome member of the community who never ceases to email or post on our social media with her kind words about the podcast. You're amazing, Sandy, and we thank you. Please rate and review our show. Give us an email shout out as well. I love getting those, and we write back all the time when we can, as soon as possible. And you can be part of the shout out as well. And stay tuned for the fun antics of our Wednesday live stream. And we will be bringing you some updated fun stuff on our next vacation coming up this week. So stick around, check out our socials. We'll see you next time. It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more, and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
While we try to keep BS Free MD as raw and real as possible, we can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.